Welcome to my presentation. My name is Ajifalake Dare and my student ID is 19172283. In this presentation, I am going to be reflecting on the role play that I participated in for a multidisciplinary team discharge planning meeting for a patient. The role play involved a patient, the patient's sister, who was also the patient's carer, myself as the inpatient mental health nurse, and other specialists in the team. The outline of my presentation structure will be firstly to introduce my role in the case meeting, also followed by outlining how I negotiated the role with my peers. I will provide a rationale for my chosen role. I will talk about my input in discussing the collaborative action plan. I will discuss my contribution also in supporting the patient and the carer. All of this will be drawn from evidence-based literature for pertinent areas of my presentation. My chosen role. I chose to play the role of an inpatient mental health nurse in the case meeting, and this is because this role is central to the patient's care at the point of discharge. Also, because I had previous experience in my student placement on how mental health nurses supports patients, and I felt that this patient in this scenario would need the support of an inpatient mental health nurse. So I chose to play the role of a mental health inpatient nurse. I'll also talk about how I negotiated my role with my peers. I negotiated this role. How I negotiated this role was that in my group, we first considered the complex needs of the patient and the possible specialists that would be needed to be involved in the care of the patient, and then we made a list of these. Afterwards, we asked each one of us what role each person would like to play. Then for myself, I then asked my peers if it was okay for me to play the role of the inpatient mental health nurse. And for them, they saw the enthusiasm in me. And so we agreed, and everyone in the group also chose their roles, also chose the roles that they were interested in. And then we all agreed. We went home after that meeting, and then we did our individual work and research about our chosen roles, and then came back together for the next meeting, which was the discharge meeting with the patient's family, and other specialists involved in the patient's care the following week. The rationale for choosing this role is that I have previous experience in placement on how inpatient mental health nurses support patients, and I felt that the patient in this scenario would need the support of an inpatient mental health nurse. Also, because on graduation, I have interest in working as an inpatient mental health nurse. I felt this would allow me research and also gain more knowledge after the case meeting. I will use Gibbs' reflective cycle to critically examine my role as an inpatient mental health nurse. Also, I'll talk about the challenges that I faced and how this experience has shaped my understanding of multidisciplinary teamwork, shared decision making, and ethical considerations in discharge planning. Gabe's model consists of 6 stages, which will be the description, the feelings, evaluation, analysis, conclusion, and then action plan, which I will apply to structure my reflection. The role play that I took part in simulated a multidisciplinary discharge planning meeting for a patient, and I assumed the role of an inpatient mental health nurse, while other participants included the patient's sister, who was her carer, and other specialists. The primary goal of the meeting was to assess the patient's readiness for discharge and to develop a post discharge support plan for the patient. The patient expressed during the meeting, the patient expressed a strong desire to leave the inpatient ward, believing she could manage independently. However, our sister was concerned about ability to cope, particularly given the patient's previous relapses. The psychiatrist emphasized the importance of medication adherence, while the community psychiatric nurse and social worker raised concerns about community resources and also relapse prevention strategies. My contributions as a mental health nurse, my contributions as an inpatient mental health nurse were include facilitating communication to ensure that all voices were heard. I advocated for a balanced approach between patients, patient autonomy, and clinical risk, according to NICE Guidelines 2016, mediating between conflicting perspectives, especially between the patients who had their own concerns, her sister and other professionals. Um, I provided first-hand observations of the patient's mental state, engage the patient's engagement with treatment and risk factors according to NMC 2018. I promoted a person centered approach, which is backed by NICE 2016. I started the meeting by introducing my role and also emphasizing shared decision making, which is a key principle in mental health nursing. As the discussions progressed, tensions arose, particularly between the patient and her sister. They had their own concerns. I played a key role in de escalating these tensions by summarizing perspectives, allowing them to listening to their concerns, allowing them to share um, their concerns and listening to them, reinforcing the importance of structured support and keeping the discussion solution focused. After that, a compromise was reached. The team agreed that the patient will be discharged, but only with a structured support plan, including frequent follow-ups, frequent follow-up visits from the community psychiatric nurse, a crisis intervention plan in case of relapse, a community support services to assist with daily living, a family support meeting to involve the sister in ongoing care. I'll talk about my feelings. At the start, I felt very confident, but as tension escalated, I experienced frustration when the patient and her sister dismissed professional concerns. This became a bit challenging for me. I was also concerned about the ethical balance between autonomy and safety, which were very paramount to patient care, which is a fundamental challenge also in mental health discharge planning. During the meeting, I used active listening and structured communication to help me to redirect discussion towards collaborative solutions. I actively and clearly communicated my recommendations and listened to the view of others, including the patient and the carer, without interrupting them. I showed empathy to the patient and listened attentively to their own concerns. I showed empathy to patients, listened attentively to their concerns, and I reinforced their dignity and autonomy. Additionally, I acknowledged the carer's stress. I also validated their concerns and ensured that they were aware of available support. Active listening involves fully engaging with the speaker, demonstrating understanding, and responding appropriately, according to Henderson et al. 2018. In nursing, this practice helps to clarify concerns, it helps to validate emotions, and also to build trust amongst team members. Effective listening prevents misunderstandings that can lead to error in patient care and also promote a culture of respect and cooperation. This is backed by O. Daniel and Rosenstein 2008. I'll now move on to the evaluation of this, what went well during the discharge planning meeting. uh, I ensured that all perspectives were concerned, aligning with multidisciplinary team best practices. I also ensured that the balancing patient autonomy with risk management as recommended by the Mental Capacity Act 2005. I encouraged a person centered approach, which is backed by the NICE guidelines. So now I'll talk about what could have been better during the simulation or the discharge planning meeting. Well, managing conflict was challenging because people had their own views, and this highlighted the need for better de-escalation strategies. The meeting lacked structure at times. I noticed that this meeting lacked structure at times, and we had to struggle a bit listening to each other perspective calmly and with respect as well, without interrupting each other, leading to prolonged discussion. Research highlights that poor communication contributes to medical errors, while structured communication combined with active listening can mitigate risks. That's according to Ferranda et al. 2016. When nurses actively listen and utilize structured communication, they help align team goals, resolve conflicts, and create collaborative solutions that will prioritize patients' well being. And this is backed up by Weaver et al. 2014. I will applying Tuxman's 1965 team development model. I recognized how my team moved through different stages. The first one was the forming stage. Here we started by defining roles, each other's roles, and what we do, and understanding the patient's complex needs. I ensured that my role as the inpatient mental health nurse was clearly communicated to the group, and that the discussion remained focused on patient safety. Then there was the storming stage. Differences emerged here, particularly between the inpatient team, the community professionals, and the carer. And we ensured that there was respectful communication, and active listening helped to mediate disagreements. After this was the numbing stage. As discussions progressed, I noticed that there was a shared understanding of the patient's risks and needs emerged. I ensured that both the patient and carer felt heard and valued, reinforcing the importance of empathy in decision making. This is backed by William 2020. And then we moved on to the performing stage. I realized that the team at some point had a structured collaborative action plan, which was created and it integrated input from all team members while ensuring patient safety and autonomy. And then we moved on to the adjourning. The team concluded with a clear and documented plan with responsibilities assigned to different professionals. At this point, we had reached consensus on the best plan on what we felt like was going to work for the patient. After listening to each other's views, having the disagreements, and the team now had to come together to conclude with a clear and a documented plan, and the responsibilities were assigned to different professionals at that point. So, by following Tuckman's model, the team moved from individual perspectives to a collective, well informed decision. And this is backed by West 2012. Then I'll talk about the group dynamics. The group dynamics influence communication, collaboration, and decision making within teams. Understanding these dynamics is very crucial for fostering effective teamwork, as cohesive teams can analyze problems from multiple angles, leading to innovative solutions. And research suggests that structured team work dynamics help reduce groupthink and encourage diverse perspectives, improving decision accuracy. And this is backed by Kajinalp and Duran 2019. Strong group dynamics also foster trust, respect, and psychological safety among team members. In my group, I realized that reflecting on this, I realized that people that were in the multidisciplinary team, They were from various backgrounds, and the way that we communicate was also essential. And we had our own views also on the team. But as time went on, we knew that we had to work as a team. And also, I'll talk about strong group dynamics, foster trust, respect, and also encourages psychological safety among team members. Cohesive teams are more. It has been researched by Oxford Research Encyclopedia of Psychology that cohesive teams are more engaged, motivated, committed to shared goals, which improves the overall performance and then the job satisfaction. Effective, according to research, effective MDTs improve patient outcomes, reinforcing the importance of strong interprofessional communication. Sorry, uh, and in conclusion, I will talk about this experience that it has enhanced my confidence in facilitating MDT discussions. I now have it has made me to have a deeper understanding of balancing patient centered care with clinical risk management. The importance of structured communication, conflict resolution strategies, and also the importance of active listening became evident during this process. I'll talk about moving forward. I'll um, I'll talk about my action plan moving forward. I will develop my conflict resolution skills by engaging in further training and reflective practice, which I feel that it will help my future practice a lot, and also help me to develop valuable skills in attending MDT team discharge meetings in future. Also, I will develop my conflict resolution skills by engaging in further training, reflective practice. I will improve ability to structure meetings by adopting standardized frameworks for communication. I'll continue advocating for patient centered care while ensuring safety through risk assessment and collaborative decision making. I will use debriefing sessions with colleagues to reflect on challenging cases and also identify for improvement, because when debriefing sessions occur, we are able to reflect on what has been challenging in particular scenarios, and also we will be able to identify as a team working together. We'll be able to identify the areas that need improvement, and we'll be able to pick up from past events, past cases, and be able to work on this as a team, and also use this to improve our practice and also improve patient outcomes, which is very essential. Provide good quality care to patients. To be able to provide safe and effective patient care to the patients at large. Also, using person centered care to be able to improve patient outcomes. By implementing by implementing all of these strategies, I aim to enhance my effectiveness in multidisciplinary team settings, and also to contribute my quota as it relates to improve patient outcome. In conclusion, this meeting made me to understand the usefulness of MDT when specialists come together to have a meeting, which alongside with family and patient, it enables us to hear the patient perspective and also that of the family, listening to their concerns, validating listening to their concerns, and also listening to their views to be able to involve them in their own care, which is very essential in nursing. I have come to appreciate how decisions are being made how decisions are being made in the multidisciplinary teams, and how this has been effective in most cases, and how this improves patient safety, patient outcomes, and also providing support for family. Thank you very much for listening to my presentation, and I've come to the end of my presentation. Thank you.